how to manage symptoms of pelvic organ prolapse. I'm going to teach you 3 things in this video. And if you incorporate all 3 of these things into this video, it is going to help you heal your symptoms of pelvic organ prolapse. Now, symptoms of pelvic organ prolapse can feel like heaviness. It can feel like something's stuck in your vagina. You can be peeing a lot or leaking urine when you don't want to be peeing. And you could also be experiencing back pain or hip pain. These are all very common symptoms of pelvic organ prolapse, and I want to help you manage the prolapse symptoms. Now, a lot of times people wake up in the morning and their prolapses feel better in the morning. The reason they feel better in the morning is because you've had all night laying down for the organs to suck back up to their homes. But then the minute you get out of bed in the morning, things start to drop and feel heavier and get heavier. And we want to prevent that from getting worse. So I'm going to teach you some things to do during your day that is going to help keep these organs in the right places. And so, like I said, I'm going to give you 3 exact exercises to be doing in order to help heal your prolapse. And I'm going to give you 1 bonus tip at the very end of this video. So stay tuned through the entirety of this video. Like and subscribe to find out more about healing your prolapse today. The very first thing we're going to do is I want you, after you spend about an hour on your feet and you start to feel the symptoms coming on, one of the best things to do is to lay down for 5 to 10 minutes on an elevated surface. So for me, 1 pillow is enough. For you, you might need 2 pillows. Now, you can just lay here like this, and we're gonna do some breathing. The reason we're gonna do some breathing is it's gonna help open up the pelvic floor. And you might be thinking, but I wanna be squeezing and holding my organs in. Wrong. We want the pelvic floor to be dynamic enough. A lot of times the pelvic floor is too tight, which then squeezes on the organs even more, creating more pressure. So if you imagine a nice bowl as your pelvic floor and you have a grape in the bowl, the tighter the bowl is, it's going to squeeze on that grape and squeeze that grape down and out. So we need that bowl to open up in order to allow the grape to float freely. That's what the breathing is going to do here. So my first tip to you is to get into this position. Get your hips up. And for me, 1 pillow is enough. Again, you might need 2 pillows, and find what feels comfortable. This is the very first modification. So you're just on your back, 5 to 10 minutes, an hour or so after you've been on your feet or whatever elicits your symptoms from coming on. This is position number 1. Now, we're going to take position number 1 and we're going to move on to the breathing part of that position. This can be done in any position, but if you're already spending time on your back with your hips elevated, then you can do this breathing exercise in that position. So I'm going to go back to that position for me in order to demonstrate what that looks like. So here you can see what 2 pillows looks like underneath the pelvis. And again, you might just need 1, you might need 2. They also sell different wedges that you can purchase to help wedge your pelvis up, and that will help shake the organs back up and into their places. So when you're in this position, if you want to do your breathing in this position, you will be able to knock out 2 tips in this video. So not only are you getting into the position, but now you're going to incorporate the breathing. What that looks like is if you place a hand on your belly and a hand on your chest, you want the air to go all the way into the hand on the belly. So you're going to deep breath in to hand on belly, exhale. Not much is happening with my hand on the chest. I'm trying to drive the air all the way down into the belly. Deep breath in, exhaling, letting go. As I inhale, I'm imagining the pelvic floor opening. I'm imagining vagina opening, anus opening to really help open up pelvic floor. Again, allowing room for my organs to go back to their places and take the pressure off of those organs, which is the pressure that's often making the symptoms of the pressure worse. So incorporate this into your routine, 5 minutes of breathing every single day, and it's going to help to heal your pelvic organ prolapse symptoms. The third non-negotiable tip is how to have a healthy bowel movement. We want to make sure we get this bowel movement without having to push, because the more we have to push, the more that there's going to be pressure on our pelvic organs, making the symptoms worse. So let's go through how to have a healthy, happy bowel movement without creating more pressure on our pelvic organs. You're going to get to the toilet. You're going to lean forward if that feels comfortable for your body. If that feels too scary or you feel like things are getting stuck, then just find a position, even if it's reclined on the toilet, that your body feels relaxed, comfortable, and safe. If the prolapse is too bad or too uncomfortable, you can use a technique called splinting, where you simply just take a thumb and insert it into the vaginal canal, and you can push it towards the rectum, or you can just simply place it right outside the rectum, providing space, what we call on the perineal body. That is the area between the vagina and the rectum. And so you can use a splinting technique to support this, but you might not feel like you need to do that, and that's okay too. So you do what feels like the best support, where you can strain the least, where your stool can exit easily without getting trapped and stuck. So we're in this nice flex position here. And as we're in this position, we're gonna take 3 breaths into our bellies. So you're here, deep breath into belly, exhaling. On the top of the 3rd inhale, you're gonna gently bear it down like you're trying to fart, but you don't want anyone to see you fart. It's the only pressure you're gonna generate. Ideally, your poop is so soft but yet well formed that you can just simply breathe the poop out and you won't have to initiate any bearing down. The bearing down is simply elongation of the pelvic floor, although that can be really hard for people. So that's where people start to generate pushing and pressure. So my challenge for you is to just start to breathe the poop out. See if you can, in this bent over position, you can be on your elbows as well if that's more comfortable for your body. You can do 3 breaths, and at the top of the 3rd breath is when you're gently gonna bear it down. That is a non-negotiable. This takes dedication to poop like this. A lot of times, especially women, they just get to the toilet, they poop, and then they go. And it's quick and it's fast and there's no time for even a breath. Instead of that, make yourself sit down on the toilet. Take a couple breaths and breathe the poop out. Your pelvic organs and your pelvic floor will thank you, because this is gonna help cure a lot of the prolapse symptoms. Okay, my bonus tip, my most favorite tip for healing the pelvic floor and healing the pelvic organ prolapse is to do this before you do any exercise and or long walks or whatever you find to be your workout. Do this tip and you will thank me. So my tip to you is, before you work out, even if you're gonna go for a run outside or if you're hitting the gym, is that you do a couple bridges where you're simply gonna lift up, pushing your knees away from your body, and you are gonna take your hands, and for me, it's like right above my pubic bone, and for you, it's right above your pubic bone. I'm taking my thumbs and I'm just lifting up towards my head and kind of shaking my organs up towards my head. And then I can come back down, and then you can go up into it again. And again, I'm just pulling my bladder up, I'm pulling my uterus up, pulling my rectum up, everything kind of up towards my head. And you can use your hands to do this. And again, you can kind of shake to kind of shimmy everything up and in, and then come back down. You can do a couple where you don't assist the organs to glide up. But this just feels really nice to pull everything up and out of the vaginal canal before you go for a workout. Okay, these are my non-negotiable prolapse tips for you. And if you start to incorporate these, your prolapse is going to get better. All right, I'm Dr. Allison Felt. Please like and subscribe to these videos, as we love putting out this free content for you, as we want you to live healthy, happy lives and keep your organs inside your body. Take care.